Imagine for a minute if there were no dentists in the Philippines. We didn't have any dental schools. So the scenario would be the same. You would have a few dentists that migrated over here. They would set up practice. You wouldn't know very much. The average person would not know about oral hygiene, about knowing how to brush and floss and take care of their teeth. And you can imagine if I was the first dentist in the Philippines, every person I'd check would have a problem, don't you think? So I'm not the least bit surprised that every person I check, when I check their spines, has a problem. Almost every person I check has a problem. So the lack of general familiarity with chiropractic, the lack of schools, the lack of availability of chiropractors, it simply means most people know very, very little about chiropractic. So this is a profession that when it's not present, people suffer more pain, more disabilities, and unfortunately more health problems that when it's managed medically, that they end up getting medication or surgery, and this is something that could have entirely been avoided. So let's talk about the non-medical and the non-surgical side of things. What sets the chiropractic profession apart is that we have proclaimed and identified ourselves as a learned profession that helps people overcome their health problems without the use of drugs or surgery. How do you say that happens? Well, take someone who comes in with headaches or neck pain, and the doctors would give them what? Pain medicine, right? Anti-inflammatory, non-steroidal anti-inflammatory, or they'll give them pain medication, or they'll just simply say take some paracetamol or an aspirin. But the reality is the problem being fixed? You take pain medication and it's covering up the symptom. One of the things that impresses me the most about in the Philippines, general population tend to not be so quickly interested in taking a lot of medicine. People sit here in my office all the time and they say, I'm particularly interested in having my problem taken care of because I'm suspicious that taking medicine is going to give me problems down the road. Do you agree? Most people find that to be the case. We're stuck taking medicine because we have no other choices. We're stuck taking medicine because we don't know to go to a chiropractor and we end up in the emergency room or a doctor's office, and because they are medical doctors. That's the way they're going to treat you. They're not trained to be a chiropractor, they're not trained to be an optometrist, they're trained to be a medical doctor. So their solutions for you will always end up, and your experience says this, that at the end of your consultation they will do some tests, and then based on what they think they find on the tests, you will then be given a prescription. So what are some of the concerns that people seek chiropractors for? Well, for the most part, people have pain. When they suffer pain, of course, it's an alarm, right? So when you have a detector in your house, smoke detector, an alarm, when that goes off, all of a sudden life stops. You have to go do something about it. And so very often that's the type of condition that people come to see us for. The reality is that's already too late. Many people actually have learned that by referrals that they can come to a chiropractor when the condition isn't quite so serious. But when people do come in pain, we take care of them. So the question is, how does a chiropractor help me, right? How does a chiropractor help your particular problem? So we begin with a consultation. The simple process of sitting down, asking you what's wrong, what has happened, how did it get there, try to make some sense of why something is not right. And during that conversation, we discuss your history, what kind of care you've done before, who have you seen, how is this condition progressing over time, and is there a chance that your particular problem will respond to chiropractic care. Now myself, I've been in practice since 1979. That puts me about 34 years of practice. We're able to look at these conditions and routinely see that, in fact, I've seen this before, these kinds of problems. Now, what are some of the questions that you would have regarding chiropractic? Well, I would suggest that there's a place you can get some answers. I am a wellness author, so you can go to my website, which allows you to interchange ideas and questions with me. It's called Doc Mike Blog. So DOC, Doc Mike, M-I-K-E, blog.com. And you can go there and read the existing articles that have been published on wellness, talks about all the typical conditions that my patients share with me, the concerns that they have, and I write up a simple explanation about that particular topic. But if any of these subjects doesn't cover your particular interest, please don't hesitate to send me a note. There's a place for you to ask Doc Mike, and I'll be able to review that and give you an answer in person, by email, or you're welcome to come to the office, we can discuss it, or I'll make another blog and I'll share it with everyone else because I haven't covered that topic yet.